Bismillahirrahmanirrahim. I'm Dr. Nizamuddin Uthwani and I'm working as Assistant Professor, Medical Specialist and Pharmacologist at Khyber Medical College, Peshawar. And today we are going to discuss one of the most important topic, and that is the introduction to the chemotherapy. Today, the first lecture of the chemotherapy, then we will discuss the penicillin, cephalosporin, the rest of all antibiotic in upcoming lectures. What are the learning objectives for today's lecture? Define the chemotherapy, explain the antibiotic resistance, describe the bactericidal and bacteriostatic drugs, describe the proper selection of antibiotic, and then describe the antibiotic combination. Chemotherapy are those drugs which are used to kill the microorganism or the cancerous cells. If we are using it to kill the microorganism, we call it as antibiotic, and if we are using it to kill the cancerous cell, we can say that this is cancer chemotherapy. If we are using to kill the malarial bugs, we can say antimalarial. If we are using to kill the tuberculous bugs, we can say antituberculous. If we are using to kill the virus, we can say antiviral. If we are using to kill the fungus, we can say the antifungal. But collectively, all of them is called the chemotherapy. What are antibiotics? Antibiotics, if you then split the chemotherapy further, so those drugs which are used to kill the microorganism, we can say that these are the antibiotics. What is the MIC? Minimum inhibitory concentration is that minimum amount of concentration which is needed to inhibit the growth of the drugs. This word is usually used for the bacteriostatic antibiotic. So that is the level at which a drug inhibit the further proliferation of the microorganism. We call that as a minimum inhibitory concentration. And the other one is the minimum bactericidal concentration, is that minimum amount of concentration which is used to which is supposed to kill the microorganism. We can say that is the minimum bactericidal concentration, and these both can be identified with the help of the culture and sensitivity. Now coming to another very important definition, that is the antimicrobial spectrum. We sometimes say these are the broad spectrum, the narrow spectrum, extended spectrum. So spectrum is basically the scope or the power of an antibiotic which kill the microorganism. Some antibiotic has got high scope, high power, and they kill multiple microorganisms, while some antibiotic has got very narrow scope and narrow antibiotic activity against the microorganism. So they are further classified into narrow spectrum, which kill only one type of microorganism, then the extended spectrum, which kill more than one type of microorganism, yani it's kill both the gram-positive, gram-negative, or it can kill more microorganism in the gram-positive. And the third one is the broad spectrum, which kill the gram-positive, the gram-negative, the anaerobes, and so many other, the spirochetes and so many other microorganisms. We call those antibiotic as the broad spectrum antibiotic. Now coming to the history of antibiotic, in the First World War, most of the people they died because of the wound infection. So in 1929, the first antibiotic, the penicillin, it was discovered by the Alexander Fleming, and after that, then an era of antibiotics started, and people have discovered a lot of antibiotic. And then the Alexander Fleming, who got the Nobel Prize for this work in 1945. What is the mechanism of action of different antibiotics? Look. If you read the book, in the book it is written in a very systematic way. We start from the cell wall. There are cell wall inhibitors, then the cell wall, then the cell membrane inhibitors, then the protein synthesis inhibitors, and then finally coming the steps of the DNA and the RNA synthesis inhibitors, or some of the drugs they follow the miscellaneous methods of and they have miscellaneous type of mechanism of action. So we will discuss all of them in their corresponding in their related topics. We will discuss all of them in detail. So we have inhibition of the cell wall, inhibition of the cell membrane, inhibition of protein synthesis, the nucleic acid synthesis, right? It means DNA and RNA, and inhibition of folic acid synthesis and other miscellaneous mechanism. This is a very important it is a very important slide. You can even download this picture from the Google, and all the antibiotic which have got the different function that it is shown in this figure in detail. Again, this is further elaborated, the same figure, but it is elaborated, and this one is easy to remember. So the cell wall inhibitor, all the beta-lactam antibiotic, they are the cell wall inhibitors. Then coming the plasma membrane inhibitors, we have the polymyxine, colistin, the lipopeptide, and so many other. Then it's come to the ribosome, which is the protein synthesis. So it has got two subunits, one is the 30 and the other one is the 50 subunits. Some drugs work on the 30 subunits, some work on the 50 subunits. You can easily memorize these drugs, and you can easily download this lecture from the internet. Now coming to one by one to all these mechanisms. The cell wall inhibitor, they just inhibit the cell wall, the growth of the cell wall, and thus make it fragile, and there is leakage of the intracellular material, and usually the cell die, the microbes die. So those drugs which inhibit the cell wall, they are usually the bactericidal, they kill the microorganism. The other one is the inhibition of the functional cell membrane. These drugs, they inhibit the functional cell membrane. Again, there is fragility in their cell membrane. Again, there is leakage of these of the material of the cells, and again there is a death of the cell. So all those drugs which are inhibiting the cell membrane and all those drugs which are inhibiting the cell wall, we consider both of them as the bactericidal antibiotic. The third one is the inhibition of protein synthesis. These drugs, they work either at the 30s or the 50s of the ribosomes, and thus they inhibit the protein synthesis, and by inhibiting the protein synthesis, they decrease the growth and further division of the microbes, and we can say that such type of antibiotic can be considered as bacteriostatic. So the chloramphenicol, the macrolide, the clindamycin, the tetracycline, aminoglycosides, these are the group of antibiotics which work through this mechanism. The fourth mechanism is the inhibition of the DNA and RNA synthesis. So by inhibiting the DNA and RNA synthesis, these drugs, they stop the further division of the cells, and by stopping the further division of the cells, no more copies of the microbes come out, and the old one, they die by itself. So these drugs, that you can say that these are the drugs like quinolones, like metronidazole, like rifampicin, and so many other drugs. They just stop the replication of the DNA, and they stop the copies formation of the microbes, and thus they are considered as the bacteriostatic drugs. And then the inhibition of the folic acid synthesis. Some of the antibiotics like the sulfonamide, the trimethoprim, they work as a cofactor. They work as a substrate for the folic acid. Folic acid is a cofactor which is involved in many steps of the cell division. So they replace that folic acid, and that they disrupt the normal process of the cell division. So you can say that these are also the drugs which we consider as a bacteriostatic. So for infection, this is another very important terms. When you are using one antibiotic for certain disease and you get another infection, we call that as a super infection. Like suppose if you have got pharyngitis, or you have got enteric fever, and if you are using the antibiotic, and with using of antibiotic you develop either the oral thrush or some other infection, we can say that the The other two very important terms, one is the empirical therapy and the other one is the definitive therapy. Empirical therapy, when you are using antibiotic by using your knowledge, your experience, and the existence of that microbe, the prevalence of that microbe in your community, and you are just using these antibiotics without the availability of culture and sensitivity report. And most of the time we are doing this. Suppose if you have got pharyngitis, so you can say that this is a gram-positive infection, and you can use any antibiotic according to your knowledge, according to your experience. So empirical therapy is the use of antibiotic before the availability of the culture and sensitivity report. It is not a blind writing of antibiotic. It's depend upon so many factors: your local factor, your experience, and the community prevalence of that particular disease. The definitive therapy, when you get the culture and sensitivity report and you then prescribe the antibiotic according to that culture and sensitivity, we call that as a definitive resistant to therapy. Some of the antibiotics, they use the concentration dependent killing. It means that if you increase the concentration well above the MIC, it will kill the microbes. Though if it is for a very short period of time, again it will kill the microbes. So some antibiotics, they use the concentration dependent killing. Some of them use the time dependent killing. In the time dependent killing, if you even slightly take the concentration above the MIC and keep that concentration for a very longer period of time, those antibiotics will kill more microbes. So one is the time dependent killing, the other one is the concentration dependent killing, and the third one is the post antibiotic effect. Post antibiotic effect means even if the concentration of a drug in plasma fall below the MIC, still it's produced some antimicrobial activity, and this is the characteristic of quinolones, and we are using this terminology, post antibiotic effect, for that purpose. Then we are using other two terminology. One is the bacteriostatic and the other one is the bactericidal. Those antibiotics which stop the proliferation and growth of the microorganism, we call them as bacteriostatic. They don't kill. The microbes kill by itself, but these drugs, it block the copies formation of these microbes. So we call them as bacteriostatic, and bactericidal are those antibiotics which kill the microorganism. To make it simple for you, those antibiotics which are working on the cell wall and working on the cell membrane, we consider them as a bactericidal, and those antibiotics which are working at the DNA, RNA, and ribosome level, we usually consider them as a bacteriostatic antibiotics. Combination of antibiotics, suppose if you get a severe type of infection, so you can combine more than one antibiotic to kill those bugs. Though it increases the cost, it can increase the toxicity, but again it has some benefits. It will give you better result, it will give you better coverage, it will decrease the duration of therapy, and you can say if you get one antibiotic and if you need to use that antibiotic for a very longer period of time, and with the usage of that antibiotic for longer period of time, you get adverse effect. So if you combine that antibiotic with another antibiotic and use it for a shorter period, you can even decrease the adverse effect of that particular antibiotic. Then the resistance to antibiotics, so many ways the drugs develop resistance. There may be changes in the cell wall, there may be changes in the proteins, there may be changes in the nucleic acid, there may be changes in the other supporting tissue, other supporting materials which are helping the antibiotic to kill the microbe. So there may be genetics, there may be acquired. Genetic, like suppose gram negative, they are resistant to penicillin because their cell wall have a lipopolysaccharide layer, and the penicillin doesn't work against them. And some of the resistance is acquired. If you are using an antibiotic again and again against certain microbes, the resistance develop, and we can say that this is the acquired type of resistance. There may be cross resistant. One microbes may be resistant to more than one antibiotic, and you can say that there is cross resistance. So these are a few mechanisms: inhibition of uptake of a drug, there is efflux of drugs, change in the enzyme, change in the target molecule. These are the different mechanisms through which the drugs can develop resistance. You can take the screenshot of all these slides. You can stop the video and you can read these by yourself. But these are just simple terms what I have explained to all of you, that there are 4 or 5 main mechanisms by which the drugs develop the resistance. One, changes in the cell wall, stopping of the influx, changes in the enzymes, changes in the target molecules, changes in the genetic material, the DNA and RNA, and there is efflux of the antibiotic from the cells. So these are the mechanism. There are some other definition through which we use this definition in case of the drug resistance. Transformation, when one microbe which is resistant to many antibiotic, analysis of that microbes genetic material get released, and those genetic materials get incorporated into other microorganisms and they develop resistance. This is called transformation. The other one is the transduction, and when the genetics material from one microbe is transferred to another by bacteriophages. Bacteriophages are the viruses which infect the bacteria, so they can do. Conjugation is another process through which when the genetic material of two microbes, when they come close to each other, there is direct exchange, and we can say that this is another procedure. And the third one is the transponents. These are basically the genes. These are the jumping genes which transfer from one place to another in the same microorganism, and they can facilitate the different sort of resistance. These are the different processes through which the the microbes develop resistance to these antibiotics. You can stop this video and you can read it by yourself. Then how we will prevent these resistance? There are some responsibility of the patient. The patient should not demand the antibiotic. They should use those antibiotics what are prescribed by the doctors. They should not skip the dose. They should finish all the dose. They should not give the antibiotic for another disease and for another attack. So these are the responsibility of the patient, and responsibility of the health professional are very important. You just do not treat the viral infection with antibiotic. Prescribe those antibiotic which is needed for that particular patient. Avoid unnecessary overlaps in antibiotic. अगर एक मरीज को एक दवाई लिखी है तो just wait for the full period, and don't hesitate or don't try to prescribe another antibiotic so early. General principle of anti-infective therapy: you just identify the infection, then identify the pathogenic organism, identify the gravity of disease, कि कितनी infection है, कितनी severity है, and then use these different terminology, use these different factors like age, gender, इसके अलावा कोई comorbidity है, pregnancy है, and then you select the antibiotic and treat that particular patient. What will be the ideal antibiotic? Number one, expensive now. Number two, it should be available everywhere. Number three, it should have a broad spectrum. Number third, it should have a low resistance. Number fifth, there should be very little amount of adverse effect of that particular drug. So these are some of the qualities of a very good antibiotic. Again, you can stop this video and you can read it by yourself. So with this, I came to the end, and this is the summary. Chemotherapy is a drug with treatment of microorganism. Antibiotic kill the microorganism. Antibiotic works through the multiple mechanisms जो मैंने explain किया. Antibiotic resistance developed through multiple mechanism already मैंने explain किया. Super infection वहाँ पे आती है जहाँ पे आप super antibiotic use करते हैं. And bactericidal drugs should not be given together. उसका रीज़न ये है कि bactericidal antibiotic kill the microbes whenever there is rapid cell division. अगर आप ऐसे antibiotic दे रहे जो bacteriostatic हो, it will stop the cell division and it will make it difficult for the bactericidal antibiotic to kill those microbes. With this, I can thank you very much. God bless you.